How do you use a TENS unit for pain relief? Hi, I'm Dr. Dave Candy, and in this video, I'm going to show you how to use a TENS or EMS unit for pain relief. Now, TENS and EMS are technically different things, but a lot of modern units do them both in the same unit. TENS stands for transcutaneous electrical nerve stimulation, meaning it goes through the skin and stimulates your nerves using electricity. And TENS is primarily used for pain control. Now, EMS stands for electrical muscle stimulation. You can probably see my muscles contracting here a little bit. So when you're using a TENS unit or EMS unit for the purpose of strengthening muscles or getting muscles to contract, then technically you're using EMS. Now, the differences in electrophysiology and waveform get really complex, and you're probably not interested in it. But the basic difference is that TENS tend to be high-frequency waves with shorter pulse durations, and EMS waves tend to be less frequent, but they have wider pulse widths. Now, depending on which unit you have, the settings are going to be a little bit different, but I'm going to show you with this NURSAL TENS unit that they were nice enough to send me, and I'll show you a couple of the different settings. It comes with a manual that walks you through the different settings, and technically there are 9 TENS programs, 9 EMS programs, and 6 massage programs. I tend to think this particular unit functions a little bit more like an EMS on all the settings, even the TENS settings, but that's okay because you can just turn an EMS unit down a little bit and get just the TENS settings. When you use a TENS unit, you should feel just tingling. And you can see my muscles here are quivering a little bit. So technically that's a little bit more of an EMS, even though technically it's on a TENS setting. But the basic purpose of a TENS unit is to cancel out a pain signal. When the vibration sense travels to your spinal cord and to your brain, it travels along faster nerves than painful signals. And so those faster vibration sensations reach your spinal cord before the painful sensations, and they block that signal from going up to your brain. Now, the good news is that's very effective at relieving pain. The bad news is that it only works for as long as the unit is on. Now, as far as pad placements, it depends on the specific joint you're using it on. I'm using this on my knee, so I have one channel going diagonally across this way across my knee, and another channel, the other wire, going the other direction. This comes with a guide that shows you different pad placements for different areas, but generally you want to put the area that you're treating in the middle of the pads, whether you're doing it one channel one way and one channel the other way, or whether you're doing kind of a crisscross placement like I'm doing right here. So this is a TENS setting, even though you can see the muscles contracting a little bit. You can change the settings on here by hitting the mode button on the bottom, and that'll increase the mode to a different type of mode. And when you change the mode, the intensity goes back down. So you'll have to turn it back up. And you can see if I turn this up really high, it starts creating a pretty vigorous muscle contraction because I have this right over a motor point on my leg right here. But whichever unit you get, whether you get this one or a different unit, just play around with the settings and find the ones that feel most comfortable for you. Because at the end of the day, if you're using this for a TENS setting, then it's basically just to block pain. So whatever feels like it relieves the pain the best for you, that's probably the best setting for you. Now I'm going to turn this off for a moment because I want to change the pad placements just a little bit. I'm going to change it to more of an EMS setting as far as the pad placement. So now I really actually want to get a muscle contraction. And if you're trying to get a muscle contraction, you want to put it across the muscle that you're trying to strengthen. EMS is for strengthening muscles. Now, it's not like to get strong and buff strengthening. It's to strengthen muscles that have gotten neurologically weak, meaning that the signal's not getting from your brain to the muscle to turn it on. And so this is helping to re-educate that muscle to get it back to normal strength. So it gets a weak muscle stronger, but it might not necessarily get regular strength muscles stronger. So now that we've got the pads along the muscle, we've got one channel going this way and one channel going that way. I'm going to turn the unit back on here, and I'm going to turn this up to the EMS settings, which are technically 9 and above. So I'm going to put this one at, say, 12, and we'll put this one at, say, 12 as well. So now they're both on technical EMS settings. Now I'll turn up the intensity of channel A. I'm not really sure. I guess that's on this side. You can see the muscles on the outside here start to contract. Then I'll turn up channel B. And this is pretty high. I'm turning it up fairly vigorously just so you can see it. You don't have to turn it up all the way. Just do what feels reasonably comfortable for you. And you can see this creates almost like a muscle spasm. It's a short-term muscle spasm, but it causes the muscle to contract and sort of ball up. So that's the way that you would use it for EMS. I'm going to turn that back down, turn B down, turn A down. And then last, I'm going to put it in a massage mode. So massage mode is 19 to 24, the last couple modes. And so we'll change the setting again to 19. Let's change that one to 19. And now we'll turn A up. So this is if I wanted to use it just more of like a massage type treatment. And so you can see it doesn't go into that full contraction, or it's not quite as long. Turn B up here. And this feels kind of weird, but at the same time, kind of good. So play around with the settings, find the ones that work best for you. Now, ultimately, whether you use a TENS or EMS unit for pain relief or muscle strengthening, it's not going to fix the problem long term. It's a short-term solution to relieve the pain, to allow you to do exercises or other treatments that you need to get longer lasting relief. Or it's a treatment to make muscles strong enough that they can do the exercises they might otherwise have been too weak to do. So this is sort of a bridge. It's not going to fix or cure anything, but it might be a good solution for someone who's suffering from a lot of pain or has some muscles that have gotten very, very weak, and they want to get back to more of a baseline so that they can do other treatments to get longer term relief. Now, I'll put a link to this TENS unit in the description below, and hopefully you did find this video helpful. If you learned something and found it informative, give this video a like and subscribe to our channel so you can get notified of our other videos. And speaking of other videos, here are a few other videos over here that you may enjoy. Thanks for watching, and I'll see you in the next video.